Hey, it's Dr. Cody Rall with Techforpsych. Today I'm here with Dr. Paul Drouin. He's the president of Quantum University. And Dr. Paul, thanks so much for having me this week. I actually knew about you for a couple of years before you contacted me online and asked me to come to the conference. And just being here, talking with you and learning from you has just been so much fun, and I just want to thank you for that.
Thank you, and thank you yourself to be here, because you bring such an expertise and experience, and you bring this kind of bridge between science, psychiatry, and the field of wellness and quantum medicine, if we can say.
I think that really came out of me just being really interested in technology and the different technology that we have to show things that are happening in the physical world. And I think that as technology progresses, we're going to see more and more of these things. The measurements of the brain, the measurements of particles, all these different things are teaching us so much, and bridging that between traditional integrative medicine and allopathic medicine and bringing those worlds together, I think is just so important.
It's very important. And we were speaking a little bit about this before, how to bring the field of integrative quantum medicine to the field of traditional medicine. And bio-neurofeedback is certainly a window. So who is not interested in the mind, who is not interested, to this neuroplasticity and how to modify behavior, improve health, on the base of this training.
It's almost like a window into developing the mind for people. Now, how do you see this moving forward and how it will benefit integrative medicine going further?
Yeah, there is in integrative medicine this concept of a connection mind and body. And if we look at what the way conventional medicine was exploring or describing this connection, for years they have made them apart, this kind of Cartesian medicine where the mind is here and the body is there. Then came along this last decade, many researchers speaking about consciousness and the integration of mind and body, and that has been a challenge in some way for medicine for centuries, how to blend both together. And now there is kind of a way to integrate the mind and body to this field of information. But how we convince now people that come from a more Western medicine, and neurofeedback and biofeedback, especially neurofeedback, I think will be this scientific ground, because now we can in some way measure, quantify the brain activity.
Yeah.
If I look at other that have explored this field, one like Joe Dispenza, you go in his workshop and he will, by example, use the brain mapping during his experiment and discover when they are experiencing different altered state of consciousness, the brain map is shaping and showing this transformation. Yeah. So neurofeedback is a ground where we can reconciliate concepts that in the past were kind of AJ or we cannot grasp, and now bringing them in the field of conventional medicine.
Yeah, it's just being able to demonstrate how much power the mind has over the body. I mean, in your presentation yesterday, you were talking about heart rate variability and how it is manifesting its control over the entire autonomic system, right?
For me, there is two main subjects now. Of course, there is more than that if we can look at nutrition and pain management, but the one we were speaking yesterday and today is what we call heart and brain coherence. Just to think about what will be the repercussion to train people in these two fields. We speak about heart coherence, it's using the heart variability that has now so much scientific data to be back up. And just introducing in the field of healthcare, doctor that I call pro-consciousness doctor, people that are aware of the impact of this physiology. We can now train population, we can train cohort of people that can change the outcome of their physiology and in the future, the fact that they will not have that much coronary disease, they will be less stressed. They can also resolve, mental and psychological situation, just mastering the heart variability. And what about now the brain? The same thing. We know meditation is probably the less expensive panacea that can exist. Yeah. You have thousands of research now backing up the fact that you meditate and it's an anti-aging, and then you have less cardiovascular disease and less cancer and less anxiety and depression and so on. This is incredible. So why are we not paying more attention to the fact that when someone go to see the doctor, that he can be trained in managing and creating more coherence at the heart and the brain level?
Yeah.
And we have seen this in this workshop. These can be taught in a weekend.
Right.
And these modalities can be implemented. I can see this in the healthcare in the future, where you have a doctor, conventional, of course, dealing with, disease and physical situation, but you will have also what we call, this is what I call pro-consciousness doctor or wellness doctor, who will be kind of a coach, training people and changing this balance where the client is not waiting to be diagnosed with something bad, it is just trained to prevent all these conditions. And this is where we are in the healthcare.
Yeah.
If we don't add this ingredient in the healthcare,
right.
I don't think we can solve this crisis of healthcare now.
I think I see that attitude even play itself out in meditation teaching that I've been trying to do the last couple of years, because it's almost like people are of the mentality that if I get stressed, I'll just meditate and that'll lower my stress level. And they don't understand that it's actually the day-to-day practice that actually prevents them to getting to the stress level in the first place. So I feel like that is, rather than taking a reactive approach to medicine before things get really bad, you're more proactive about it, as you said, like with more of a wellness coach. And I think that transitions pretty well into one of the themes that we've had this weekend, which is the democratization of medicine, right?
So important. There is many routes how we can develop the neurobiofeedback. We can develop the neurofeedback more kind of a medical model. And I think this is important because still, we will have people consulting neurofeedback practitioners, psychiatrists, or doctors, because they have specific conditions, ADD, autism, and they can address these medical issues with more sophisticated equipment. But again, how much we can handle people, quantity of people like this, it's very expensive. There's another way to look at neuro and biofeedback where technology now will be available in the hands of clients. And this is where the smartphone technology, digital technology come in. And does this smartphone has changed our lives in the last 20 years?
Right.
And I think the same thing will happen now in the medical field, where these practitioners will be working in tandem with the client, having this smartphone technology where at home you can practice heart variability, where at home you can create a better brain coherence through meditation or other exercise. And then the practitioner monitoring these clients, now we have software available that where he can monitor how the meditation is going and how the heart variability is going. So this is another way to democratize in a sense that we're empowering the client, with information that, I remember in medicine 40 years ago we didn't have. We had we took blood pressure and listen this with the heart with the stethoscope. Now the client has access to his brain coherence, his heart, and hundreds of other parameters. How much calorie, how is your sleep, and how is your and so on. Democratization is about creating a new balance in healthcare, where the responsibility of health is not just on the system, on the doctor that is there and you expect everything, but the truth is that will not happen. It didn't happen, it will not happen.
And you were talking about earlier how it simply just has become unsustainable at this point for an economy to even manage, right?
Absolutely, yeah. Come from Canada, we have universal healthcare. Come here, we're debating this now.
But these aren't the crux of the problem. The crux of the problem.
The problem is how we practice medicine. It's not the question who pay the bills, because nobody can pay the bills anymore. Right. The question is how we change our way to look at the individual. And pro-consciousness medicine is about to look at the individual, the client that walk in the office, not in terms of what's wrong with this guy, but what is the potential there, and what is that I can be doing that will enhance, the potential of that individual. Creating more awareness, using biofeedback. This is what is bio-neurofeedback. It's creating a feedback of information, so where you become more aware. This will be a game changer. This is what I'm thinking.
Yeah, I think as this was mentioned in one of the Quantum University videos, but as genetic analysis has come along, how many diseases have we really been able to say this gene or this protein? It's such a multivariate problem that you start wondering about things about like thought and how it really affects the body and how the genes are expressing themselves, and how we can see that if you do a meditative technique and elicit a relaxation response, that's turning on different genes and metabolism or immune function, and all these different things are turning on.
You are exactly now in what is the core of the medicine for the next decenny. We have to make a choice, okay? We are teaching Quantum University, of course, quantum physics, new biology with Bruce Lipton.
Yeah.
You know, where the main statement is to say you're not determined by your genes. And what determines your genes is how you think, you know, your environment, your emotion, you know, this field of information around you. So what this means? It means that at the end of the day, you are master of your health destiny. In the old system, and that will cost a lot if we still to think this way. It's like, you know, here you have your genes blueprint. And in 20 years you will have this disease, you will have this disease. Can you imagine the costs that can generate? Because everybody will go, you know, as we have seen a few years ago, you know, I will not say any name, but this famous actress, you know, going to surgery because now she was in fear to have a breast cancer and so on. So this way of thinking, and let's realize, you know, what is the cost, the way we think. And the way we teach our doctors, not only doctor, but even natural medicine doctor in university, you know, because this is at the end of the day the one who paid the bill, you know, get, you know, it's like the way you think, the foundation of the curriculum has consequence later on, you know, on these effects. And just thinking about genetics, you know, it's dramatic. If we go in the route where we determine by the gene, there's nothing we can do. We have an army of doctors that is just establishing the disease, that most of the time we just have symptomatic treatment for. We are in a doom, going into a doom route. If the other way you start to train doctors that are more, let's say, oriented to this pro-consciousness medicine, where they see the client in terms of potentiality, now we have totally a different outcome at the end.
Well, I love that the vision is empowering the client or the patient. It's just so awesome. And I love the work that you guys are doing here in terms of really being brave, in terms of bringing in this idea and not even necessarily standing up to the medical community, but say, hey, there's another aspect of this. We need to consider this. And this is bringing in integrative medicine. And I know that I had said earlier that I've been seeing that more and more in my practice, especially with the military, bringing in different alternative treatments, because when it comes to things like PTSD or traumatic brain injury or these other chronic ailments, they don't have a very good, you can't just automatically do surgery for someone, or you can't give them a specific medication. These wraparound integrative treatments are what is really showing to get people better. And you guys, I think, are just, you know, thinking outside of the box and really, like, you know, very intently thinking about what is the most effective strategy and how we can bring that to the client. And you guys are very, like, client focused, I noticed too. You really care about the patients.
Yeah, we care, and I like to say, you can see people come from everywhere.
Yeah.
So this, I would say, hunger for this kind of knowledge is from everywhere.
Yeah.
And it's also from medicine, because as you said, we're not, what we promote is to integrate this to the model of healthcare, actually. It's not to, and the demand is there. Now the question is where we get that information and how we get trained and how we introduce in our healthcare system this type of pro-consciousness doctor. And this is what we have designed with Quantum University. We have designed kind of a curriculum that gives this kind of broader understanding, and then at the end of the day, they can also practice modality like neurofeedback and implement this technology.
It's nice to see the technology catching up to it too, because I think that the more we learn about epigenetics, brain scan technology, neurofeedback, it really gives a lot of credit to what people have been talking about for a long time in terms of integrative medicine treatment strategies.
Yeah, you have pointed this in your conference. That's very important. You know this. You give me kind of a taste of what would be the future, because you know because what we speaking today is just the beginning. Just the first sparkle, right? Yeah. Because this first of all, the smartphone will just get more powerful, and these headbands, tracking brain waves will refine, and then we will add, as it goes, much more possibility to this technology.
The future is bright, Dr. Paul. Thank you so much for interviewing with me, and it's been a great week here.
Thank you to be here.
All right.
Your doctors like you are really big hope for this
Thank you,
healthcare. Thank you very much.
All right, if you guys have any questions for Dr. Paul, just leave comments below. We'll do our best to answer them, and thanks so much. Tune in next time. We'll have episodes coming up soon. Thanks.
Thank you.